Hello everyone, I'm Jingxi, and today my partner and I are going to talk about elective C-section. We will elaborate this topic from 6 parts, with introductions, our position statement, case studies, and our conclusion. And I will first talk about the first 3 parts. So let's begin. What is C-section? Cesarean delivery is a surgical procedure used to deliver a baby through incisions, which means cutting, in the abdomen, the position of the stomach, and uterus. The 4 small pictures around here are the process of natural birth, where the uterus contracts, the cervical canal disappears, and a uterine opening slowly widens to 10 centimeters for the baby to come out naturally. On the contrary, the pictures here present the process of C-section. The doctor first cuts through the mother's skin and then cuts through her uterus to take the baby out. There are situations when C-sections have to be done, which I do acknowledge this kind of necessary C-sections. From the baby's side, if their position in the stomach is abnormal or they have health concerns with just being too big or too many of them for the mother's pivot to handle, the mother should take a C-section for both considerations of the mom and the baby. Moreover, if it is the mother's problems, like the labor isn't processing, or there have been situations with the placenta, umbilical cord, or for the health concern of the mother, or simply she had C-section before, it is recommended for the mother to take the C-section to get the baby out. However, if C-section is in such a demand to save both the baby and mother's lives and health, why not every mom choose to take it to make their pivot suffer less? From this graph, it is a Chinese research that the number of cesarean deliveries is much less than the number of live births, and the percentage of cesarean deliveries decreased. This could lead to our point of opposing C-section, the unnecessary C-section, apart from those situations I mentioned before. And here are my reasons and stories. I am against elective C-section because it is a way of permitting those on-purpose, earlier elective deliveries. Here's the true story. According to BBC News, the article China Education, Why Some Mothers Want August C-Sections is very astonishing. Chinese media have noticed a trend of pregnant women rushing to cesarean sections before the end of August so that their yet-to-born children will be in the academic year ahead of September-born babies. It's saying that the mothers try to take their babies out earlier just to let their babies outrun other kids born after September to get into school earlier and get an education earlier. So, some mothers have made appointments on August 31st in case they cannot have a baby before September 1st while vaginal delivery. It is not actually only the mother's voice, but the family. Here's a quote from a father. The father is the picture here, saying things like, his first child experienced problems with delayed schooling as a result of being born in September, so children should be born before September. It is a case where C-section is used for 7 years later academic schooling concern. There are other reasons for the sake of superstition to make the babies out of specific years, months, dates, which is rather harmful to the baby. Though some may argue that mother is going to need permission from the doctors to get the baby out earlier, so it is not going to be a problem. However, this could trigger the improper hasten perturbation of the mother, like doing a vast amount of exercise, taking inappropriate labor hastening drugs to manually force the baby out a few weeks in advance, which could be very dangerous. Here are more detailed risks of the earlier on-purpose elective C-sections. If the mother and baby are healthy, there is no benefit to delivering the baby early, said Dr. Catherine Spong in the news. And actually, the baby in the last 4 weeks of pregnancy is doing a considerably amount of development, especially at 39 to 40 weeks of the pregnancy. A baby's brain weighs one-third more than it does at 35 weeks. The lungs and liver also continue to develop up to 39 weeks. And those last few weeks allow time for layers of fat to grow under the baby's skin, which helps keep the infant warm after birth. And studies have found a greater risk of serious medical complications, such as dangerous bloodstream infections and breathing and feeding problems in babies born before 39 weeks of gestation. One NIH-funded study looked at more than 13,000 women who gave birth by elective C-section, and the babies delivered at 37 weeks were twice as likely than those born at 39 weeks to have complications, such as difficulty breathing, heart problems, and seizures that usually require time in the neonatal intensive care unit. The mothers who choose to give birth early may also face their own health challenges. They have stronger, more frequent contractions during labor and a greater chance of getting the depression. Next, my partner will continue her point analysis.
Apart from what Jingxi said about preterm deliveries, even for the mature birth, C-section is not better than vaginal birth as well. In some cases, a C-section is performed during a term delivery because the mother is concerned that vaginal birth will be too painful, for example because of vaginal tearing. They may also be embarrassed by the possibility of incontinence during the delivery. However, if a woman is able to have a vaginal delivery, there are numerous disadvantages to having a C-section. From the perspective of the mother, because the incision is so long and deep, C-sections usually need much longer hospital stays and recovery times than vaginal birth. And there may be additional pain and discomfort in the abdomen as the skin and nerves surrounding the surgical scar heal, which can take up to 2 months. Vaginal birth typically avoids the risks of major surgery such as severe bleeding, scarring, infections, anesthesia reactions, and long-term pain. So if you want to avoid the pain of vaginal birth, C-section may not be a wise option. There are also increased risks during future pregnancies. Following a C-section, you are more likely to experience potentially serious complications in a subsequent pregnancy than you would after a vaginal delivery. The more C-sections you have, the more likely you are to develop placenta previa, a condition in which the placenta becomes abnormally attached to the uterine wall. If you adopt the vaginal birth after C-section, you run the risk of your uterus tearing open along the scar line from the previous C-section. So from the perspective of the baby, childhood asthma and allergies were increased by C-section. During vaginal birth, each generation of mothers passes on their microbiome to the next, as the baby is coated with beneficial germs. Also, during the vaginal birth, as baby is being squeezed through the birth canal, muscles involved in the process are more likely to squeeze out the fluid in the newborn's lungs. So all this stuff during vaginal delivery is beneficial because it makes babies less likely to suffer from breathing problems at birth. But this does not happen for babies born via C-section. It takes time for C-section babies to develop the normal microbiome, and because their immune systems are developing at the same time, they are more vulnerable to developing diseases such as allergies and asthma later in life. In China, there is currently no prohibition on unnecessary C-sections such as preterm labor. Policies should be put in place to discourage elective C-sections. Cases, for example, should be discussed and evaluated by doctors, and C-section should be only performed if a hospital certification is presented. Furthermore, the government and healthcare systems should collaborate on maternity education, including the fact that the birth date is not that important, receiving education 1 year earlier is not that important, and the pros and cons of having a C-section surgery. Regular prenatal and natal psychological counseling, along with regular prenatal care, should be encouraged to help pregnant women understand the differences between vaginal delivery and C-section delivery. Counseling can be included in medical insurance programs to increase its popularity, which means that it is supported by the government. In conclusion, we believe that elective C-sections should be discouraged in order to reduce the unnecessary use of C-sections. To be more specific, some families opt for a C-section before the normal labor date arrives because, for example, they anticipate a specific birth date. In this case, premature delivery will harm both the mother and the child, as we mentioned before. Furthermore, in the case of mature delivery, mothers may prefer C-sections due to factors such as pain during vaginal birth. However, the pain and discomfort experienced after the C-section are very likely to be greater than those experienced during vaginal birth. In addition, the likelihood of a C-section baby developing childhood asthma or allergies is higher than that of a vaginal birth child. As a result, we advocate for specific regulations from the government and healthcare systems to discourage people from having unnecessary C-sections, either directly or indirectly. Based on what we discussed above, our stance against elective C-section benefits not only the mothers and babies, but also the family, including fathers and grandparents, because it will be both mentally and physically released if the child is healthier in his or her future life. And as the C-section rate declines, medical resources will be saved to a large extent. Here are the references. Thank you for listening.